Hi, I'm Dr. Rainer Fischer. I'm a naturopathic physician, that is a doctor who specializes in natural medicine. And in my clinic in Scottsdale, Arizona, I focus on regenerative medicine and stem cell procedures and the treatment of chronic joint pain and other conditions. In this video, I would like to give you an overview over stem cell therapy and how it can help with chronic joint pain. First, let me quickly talk about joint pain and common causes. The most common cause of joint pain is arthritis and joint degeneration. And there are a lot of different treatments available. Let me show you a little picture that I use with my patients. I hope you can see it. And oops, like that. And what I show them is the treatment gap. So on one end, you have all those conservative treatments. Right? So that is your medications, anti-inflammatory medications, gel shots, steroid shots, supplements, and whatnot. And on the other hand, there is surgery. That is what I call the point of no return. And it is understandable that a lot of patients stay here as long as possible because all that's left is to jump over to the point of no return and do surgery. And it's understandable you don't want that, with given all the risks and the invasiveness of surgery. So you will stay here long term, get a lot of medications, doing a lot of steroid shots, and then your doctor will say, do that. Now with stem cell therapies and stem cell procedures and regenerative medicine, we have an option that can actually bridge this gap. It can really help you walk over here slowly, and you may never have to cross that bridge fully, and maybe never need surgery, or maybe much later on in life. Right? So you can stay, it will help you stay on that bridge much longer. So in this talk, I would like to talk to you how that works and what this is about. So stem cell therapy is the use of stem cells and parts of stem cells and stem cell fluid to stimulate healing and repair. So it really does repair something. There is no masking of the pain or anything like that. It really helps to reverse some of the damage that has been done there. So that is really kind of a fix of the problem. It doesn't mask anything. And how does that work? Well, typically it will be an injection into the joint or in the areas that have the problem. And once the stem cells are there, they do something. And what do they do there? They have two options. Right? They can either become a cell that's needed there. So a stem cell would then become a cartilage cell. Right? And the cartilage then does its job that's needed there because there's not enough cartilage present. It will build up cartilage, and that will help regenerate the joint, and less inflammation, less joint pain, better function, and more joint space. Right? So that's one of the ways stem cells help. Stem cells have another option. They can say, well, what's going on here? Because when you inject them, they walk. Let's say they walk by at the construction site where there is cartilage damage. This will look for a stem cell, that cartilage damage will look like a construction site where there's a lot going on, but it's kind of everybody screams at everybody, and they're not doing the work right. Because otherwise you wouldn't have chronic inflammation. Something's going on that's it's not as intended. Right? You have a chronic inflammation going on. So what the stem cells will do is say, hey, you guys, calm down, talk to each other in a proper way, and everybody helps together, then we can get this done. So they act as a construction foreman. And that is another very important function of stem cells, that is independently of the stem cells actually becoming a cartilage cell, for instance. So those two things are what really makes the effect of a stem cell procedure. Right? So where can this help? Well, it can help in all types of cartilage damage, cartilage wear down, arthritis, joint pain, even in cartilage injuries or tendon injuries, meniscus tears, and many other things. Right? Who is a good, so you may ask now, who is a good candidate for that? Well, everybody who is, if you remember that picture with the conservative treatment and the surgery, everybody who doesn't want to jump over, and everybody who is remains on the other side and has joint pain but doesn't want to jump over and doesn't want to be in the situation where surgery really is the only option. So you want to do that as early as possible, because the earlier you do it, the better the results will be. Right? So then you may ask, what, let's say, how well does it work? Well, it works really well. I've seen it work with many patients. A lot of my patients are happy, and it makes me happy because it's great to see a treatment that actually repairs things, and where patients actually are happy with the treatment. I talk to them a year later, still good, still happy with it. So this has the potential to really have a sustainable effect of that treatment. Right? So it can help you for years and years, right? And maybe down the road, if you feel it coming up, well, then maybe we have to talk again, or you talk to another doctor. Maybe there's another treatment out there, another stem cell treatment that that helps. But that is something you think about down the road, because this is a sustained effect of the treatment. Right? Then you may ask, how quickly will it work? Well, some patients have effect even after a couple weeks, right? Maybe even 1 or 2 weeks. But it will take weeks to months to have the full effect. So it is not a quick fix. But you have to consider your body has to actually repair things, and repair takes its time. Yeah, if I take a medication, it's up, I can mask the pain like that. But what you want is actual repair, and repair takes its time. And then you may ask, well, how actually can you go about that? Right? Well, what you do is first we will have to find out, are you even a good candidate? Right? So that means you will have to talk to somebody. A doctor has to take a look at it, or find out if you're a good candidate, and then you have to make a decision: is this something that you want to do or not? Right? Then, if you decide this is something you want to do, you schedule the appointment for the procedure and get it done. Right? I can the way how I do it is, you come in for the procedure. Everything can be done in one day, in one procedure, in one session. I very often use more than one treatment to further enhance the effect. I might use platelet-rich plasma with it. I might use prolotherapy with it. So you almost always will get more than one treatment in addition to the stem cell treatment. And that's it. And then we see how it works. So there's no downtime. There's no general anesthesia. There's none of that. Right? So we just see how well it works for you. Right? But I know it's a difficult decision. You may it's a process. You may be exposed to a lot of different conflicting information. So it's best to really have good information to base your decision on. So that is why, I understand where you're coming from. That is why, I want to make this process as as easy and comfortable as possible. So that's why if you think that could be something for you, and you decide to have a consultation with me, you will have the consultation actually with me in a one-to-one session. I will talk to you personally. We will talk about all different options available. We'll talk about amniotic fluid, umbilical cord, exosomes, adipose tissue-derived stem cells, because I use all of these. I use all of these. I know all the advantages, the pros and cons, and we will find a treatment that works best for you. Right? You don't want to talk to a salesperson or anything. You will only talk to me. The second advantage is I actually do the treatments, all the treatments that in my clinic. So you will talk with the doctor who actually does the procedure. Yeah? So we will find out what's best for you. And after that, so my goal here really is that you, after that, after the consultation, have everything you need to make a good, best informed decision about your treatment. Right? I don't want you to leave confused. I don't want you to have more questions than before. I will answer all your questions, and you should, after that, really know if this is a treatment for you or not. Right? And then, once you make the decision, you come in for the treatment, and we do it. So if you feel this is something, oh yeah, maybe maybe a little bit about about the quality. So